Mental illness, a term which is quite casually thrown around and yet is increasing as the days pass by. So is the number of people who still choose to be ignorant to the simple fact. Mental illness exists and people experiencing them need words of encouragement and empathy rather than disapproval. Hey guys, welcome back to our channel, and today we will be talking about mood disorders and why you need to help out people going through it in the best possible way. So what exactly are mood disorders? It mostly explains itself by its name. A mood disorder, also referred to as an affective disorder, is a condition that severely impacts mood and its related functions. Mood disorder is quite a broad term. It's used by psychologists to include all the different types of depressive and bipolar disorders, both of which affect mood. Like with a large number of mental disorders, no one really knows the exact causes of mood disorders. Research till now suggests a variety of factors that seem to contribute to them. Chemical imbalances in the brain are the most likely cause. Stressful life events like death, divorce, or trauma can also trigger depression, especially if someone has already had it before. Sometimes, it's also seen to have a genetic component running in the family line. And like with a large number of mental disorders, no one really considers them serious enough or pays attention until it's too late. 1. Bipolar disorder. Like any other mental disorder, there are plenty of misconceptions regarding bipolar disorder. And yet, this disorder affects around 45 million people worldwide, which definitely is quite a lot of people. What exactly is bipolar disorder? Well, psychologists describe it typically consisting of both manic and depressive episodes separated by periods of normal mood. Manic episodes implies elevated or irritable mood, overactivity, rapid speech, inflated self-esteem, and a decreased need for sleep. Here's where some people raise the question: what about a person who's experiencing manic attacks but doesn't experience depressive episodes? Does he or she has a bipolar disorder as well? The short answer is yes. The long answer is that bipolar disorders can be of different types. During manic episodes, people with bipolar regularly engage in activities that can result in painful consequences for themselves and sometimes even others. A person who has had no manic episodes in the past but has experienced mania and depressive episodes is also a patient of bipolar disorder, specifically bipolar 2. There are a lot of people who still stigmatize against people with bipolar disorders, usually considering them dangerous or considering people with bipolar 2 as people who are just, well, pretending. As we said earlier, sometimes manic episodes can be dangerous, but it's never an excuse to discriminate against a person who's experiencing the same. While psychological support is an important component of treatment, we can also do our part by providing as much support as possible. Effective treatments are also available for the treatment of the acute phase of bipolar disorder and the prevention of relapse. 2. Major depressive disorder. Depression, another word that's very common and yet not considered to be an actual mental disorder. Take a random guess as to how many people across the globe are affected by depression at this moment. If your guess is anywhere close to 1 million, you're still far away from the actual number. Globally, an estimated 264 million people are affected by depression, which is indeed a matter of concern. Psychologists characterize depression by sadness, loss of interest or pleasure, feelings of guilt or low self-worth, disturbed sleep or appetite, tiredness, and poor concentration. People with depression may also have multiple physical complaints with no apparent physical cause. A lot of people do not consider people having depression as actual patients. If you were unfortunate enough, you might have also come across people who think that depression is just a fancy term thrown around and giving advices like, "You're just sad, buckle up and you'll be fine." Here's the thing, sadness is not a synonym for depression. Depression can be long-lasting or recurrent, which means a person can go through it for a very short period of time and shouldn't have to hear that he or she is just sad or disappointed regarding a situation. Major depressive disorder substantially impairs people's ability to function at work or school and to cope with daily life. At its most severe, depression can lead to suicide. The statistics for suicide rates is even more concerning than depression figures. Nearly 800,000 people die by suicide in the world each year, which is roughly 1 death every 40 seconds. The obvious question that arises is, why is this number growing day by day? Well, lack of support is definitely a big reason. The most effective treatment for people with depression is proper psychological support and empathetic support from near and dear ones. The reality is that such people are getting either one of these or none at all, which is why the number keeps growing. Mild to moderate depression can be effectively treated with talking therapy such as cognitive behavior therapy or psychotherapy. Antidepressants are also an effective form of treatment for moderate to severe depression, but are not the first line of treatment for cases of mild depression. As we said, the first line is talking and understanding. Some people are also the patients of persistent depressive disorder, which is the clinical term for a person suffering from a major depressive disorder for more than 2 years. It's also important to figure out the what factor here. What are the stress factors and psychological aspects that's causing the depression? This could be anything like financial problems, difficulties at work, or physical or mental abuse, and even the streamlined sources of support such as family members and friends. As a member of an empathic community, the least you can do is to maintain or reactive the social networks and social activities in a way that removes such stress factors around the person who's suffering from depression, no matter how little time of that you can actually manage. 3. Disruptive mood dysregulation disorder. This disorder explains children up to 18 years of age who exhibit persistent irritability and anger and frequent episodes of extreme temper outbursts without any significant provocation. Just like the word sadness is thrown around to explain depression, you might hear of the word tantrum thrown around to explain this. We won't even be surprised if some of you confuse this with bipolar disorder. One very clear way that disruptive mood dysregulation disorder is differentiated from bipolar disorder is by chronic irritability. Where bipolar disorder is generally characterized by episodic changes in mood, children with DMDD have moods that are persistently angry or irritable. A lot of parents decide not to address this issue, thinking that the child will grow out of it, or may even opt for solutions that might worsen the condition, such as physical punishments. However, the symptoms of DMDD can create significant impairments in a child's life, and it's extremely important that parents obtain treatment for their child as soon as possible. The first line of treatment here is cognitive behavioral therapy, where the kids learn to recognize the thoughts that contribute to feelings of anger and learn new ways of responding to different situations. Therapists may also choose to work with parents to help them learn new ways of responding to their child's anger and outbursts. Just like for depression, it's important to figure out the trigger factors here and address them over time. Losing patience, ignoring the signs, and not taking help are definitely some of the things that people do and should avoid doing. The ray of hope at the end of the day is that millions of people who experience mood disorders or have experienced them at a certain point in life are successfully treated and live a better quality of life now. Treatments for mood disorders can include psychotherapy, also known as talk therapy, as well as medications to help regulate chemical imbalances in the brain. A combination of psychotherapy and medication is often the best course of action. The unfortunate fact is that health systems have not yet adequately responded to the burden of mental disorders. As a consequence, the gap between the need for treatment and its provision is wide all over the world. Just to put the words in numbers, in low and middle income countries, between 76% and 85% of people with mental disorders receive no treatment for their disorder. This leads to most people ignoring the signs, thinking it'll just go away in the future, or not receiving proper education about it, making them wrongfully diagnose others. What we will be saying is that if you're experiencing any of the symptoms or know someone that has been showing any symptoms that is affecting their way of life, you should seek help immediately. It's high time that getting evaluated and receiving help for mood disorders should be in your priority list as an educated individual. You should be encouraging people around you to do the same as well. If you loved the video, make sure to hit the like button and don't forget to subscribe to our channel. Also, drop in a word of support in the comment section because you never know, it may make someone out there smile after a hard time. We'll be back very soon.